Laser hair removal is a topic that has drawn increasing attention over the past few decades, especially among women looking for long-lasting solutions to unwanted hair. With technology advancing rapidly and new devices hitting the market, it's important to separate fact from fiction and understand what laser hair removal really offers. Is it truly permanent? Is it safe for all skin types, especially dark skin? What are the risks, including potential side effects like burns or even cancer? And finally, do at-home laser devices live up to the promises of their professional counterparts? Let's explore these questions in depth. First, let's address the most common question: is laser hair removal permanent? The simple answer is that laser hair removal offers long-term hair reduction, but not always permanent removal in the sense that you'll never see another hair grow again. The technology works by using concentrated beams of light that target the pigment in hair follicles. The light is absorbed by the pigment, which damages the follicle enough to inhibit or delay future hair growth. Over a series of treatments, most people experience a significant reduction in hair, with many enjoying smooth skin for months or even years. However, human hair growth is complex. Hair grows in cycles, and the laser is most effective during the active growth phase. Not all hairs are in this phase at the same time, which is why multiple sessions are required. Typically between 6 and 8 treatments spaced several weeks apart. After the initial series, maintenance treatments may be needed once or twice a year to keep any regrowth at bay. Some people, especially those with lighter hair or hormonal imbalances, may experience more regrowth than others. So while results are long-lasting, it's more accurate to describe laser hair removal as providing permanent reduction rather than absolute removal. Next, safety is a crucial concern, especially for women considering laser hair removal. The procedure has been performed for decades and, when done by a trained professional using FDA-approved devices, is generally considered safe. Most people describe the sensation during treatment as a quick snap, like a rubber band against the skin, and any discomfort usually fades within a few hours. Mild redness and swelling are common immediately after the procedure, but these side effects typically resolve quickly. Now, let's talk about dark skin, a topic that has seen dramatic improvements thanks to technological advances. Early laser hair removal devices were most effective on people with light skin and dark hair, as the contrast allowed the laser to target the hair pigment without affecting the surrounding skin. For those with darker skin, the risk of burns, discoloration, and other side effects was higher, because the laser could not always distinguish between hair pigment and skin pigment. Today, newer laser technologies such as the Nd:YAG laser have been developed specifically with darker skin in mind. This type of laser uses a wavelength that penetrates deeper and bypasses much of the pigment in the skin, significantly reducing the risk of burns or hyperpigmentation. If you have a darker skin tone, it's essential to seek out a provider who is experienced with these advanced lasers and can tailor the treatment to your unique skin type. Always ask your technician about their experience and the type of laser they use. Side effects are another important consideration. The most common side effects are temporary and include redness, swelling, and minor discomfort in the treated area. These typically resolve within a few hours to a couple of days. In rare cases, more serious side effects can occur, such as blistering, scarring, or changes in skin pigmentation. These risks are higher if the treatment is performed by an inexperienced provider or if the wrong device is used for your skin type. One of the most concerning questions some women have is whether laser hair removal can cause cancer. The good news is that there is no evidence to suggest that laser hair removal causes cancer. The lasers used in hair removal emit non-ionizing radiation, which means they do not have enough energy to damage the DNA inside your cells or increase your cancer risk. The energy is directed at the surface of the skin and is absorbed by the pigment in the hair follicles, not penetrating deep enough to affect internal organs or tissues. Multiple studies and decades of use have shown no link between laser hair removal and cancer. However, there are some precautions to keep in mind. The skin is temporarily more sensitive to sunlight after treatment, so it's important to avoid direct sun exposure and use sunscreen to prevent burns or hyperpigmentation. If you have a history of skin cancer, you should discuss laser hair removal with your dermatologist to determine whether it's a suitable option for you. Now, let's discuss home laser hair removal devices. In recent years, there has been a surge in the availability of at-home laser and intense pulsed light (IPL) devices. These gadgets promise the convenience of hair removal in your own bathroom, often at a fraction of the cost of professional treatments. But do they really work, and are they safe? Home laser devices work on the same basic principle as professional machines. They use light to target hair pigment and damage the follicle. However, they are typically less powerful than the devices used in clinics, which means they may require more treatments and produce less dramatic results. For some users, especially those with dark hair and lighter skin, home devices can be effective for small areas like the underarms, bikini line, or face. For larger areas or for those with darker skin, the results may be less satisfactory. Safety is another consideration. While home devices are designed with built-in safety features to minimize the risk of burns or skin damage, improper use can still result in side effects. It's important to read the instructions carefully, start with a small test area, and never use the device on tattoos, moles, or areas with broken skin. People with darker skin should be especially cautious and look for devices specifically approved for their skin type. If you have any medical conditions or are taking medications that make your skin more sensitive to light, consult a healthcare professional before starting treatment. Burns are a potential risk with both professional and home laser hair removal. Most burns are mild and resemble a sunburn, but more severe burns can occur if the wrong settings are used, the device is not properly calibrated, or if the treatment is performed by someone without adequate training. To minimize the risk of burns, always choose a reputable clinic with experienced technicians. Or if using a home device, follow all manufacturer guidelines and start with the lowest setting. So, is laser hair removal worth it? For many women, the answer is yes, especially for those who have struggled with ingrown hairs, razor burn, or the inconvenience of frequent waxing or shaving. The treatment can save time and money in the long run, and many people report a boost in confidence with smoother, hair-free skin. However, it's important to have realistic expectations. Results vary depending on your hair color, skin tone, and the area being treated. Some fine or light-colored hairs may not respond well to laser treatment, and occasional maintenance sessions are usually needed to keep the skin smooth. The cost can also be a consideration. Professional laser hair removal is an investment, with prices varying depending on the area treated and the number of sessions required. While home devices are more affordable up front, they may not deliver the same long-term results as professional treatments. In summary, laser hair removal is a safe and effective option for many women seeking long-term hair reduction. Advances in technology have made it accessible to a wider range of skin tones, and when performed by experienced professionals, the risk of serious side effects is low. There is no evidence to suggest it causes cancer, but as with any cosmetic procedure, it's important to do your research, understand the risks, and choose the right provider for your needs. Home devices can be a convenient option for some, but may not offer the same effectiveness as professional treatments. Ultimately, whether laser hair removal is worth it depends on your personal preferences, budget, and desired results. If you're considering laser hair removal, consult with a qualified practitioner to discuss your options and develop a treatment plan tailored to your unique needs.